Many people with diabetes hear their provider talk about their hemoglobin A1C, and they may be told if it is bad or good, at goal or not at goal, but they don't actually know what it is or what it represents. I believe that you should understand the A1C value as good as your provider. So stay tuned as we learn. This webinar will cover the definition and understanding of what hemoglobin A1C is and the purpose of measuring hemoglobin A1C. The hemoglobin A1C is usually measured in the lab with routine blood work. It may also be done on a little machine in the office. For short, I'm going to call hemoglobin A1C just A1C. So what is the hemoglobin A1C? The A1C is a certain value that reflects and indirectly measures the average blood sugar level over a 3-month time span. The A1C value is obtained by measuring the quantity of glycated hemoglobin. The amount of glycated hemoglobin refers to the sugar attached to a red blood cell protein called hemoglobin. A person's red blood cells become coated with sugar with the blood sugars that are constantly high over time. Once that cell is coated with sugar, the link is irreversible, and the hemoglobin is now glycated. As a caveat, there are also some red blood cells that may only survive 3 to 6 weeks. Therefore, the A1C is actually most greatly influenced by the last 4 to 6 weeks of blood sugars. By definition, the A1C was the average blood sugar. So here is a chart to show how the average blood sugars correlate with hemoglobin A1C. An A1C of 6% is 120. An A1C of 7% is about 150. An A1C of 8% is about 180. As a general rule of thumb, every 1% change in A1C is associated with approximately 30 milligrams per deciliter change in the estimated average blood glucose. Lowering the A1C even 1% is associated with significant decreases in diabetes complications as well. The hemoglobin A1C will be evaluated by the provider or the diabetes specialist, and it serves 2 purposes. Number 1, it is the most used criterion to diagnose diabetes. Number 2, it is a gold standard to judge how well blood sugars are controlled. Number 1, the diagnosis criteria of diabetes by A1C is as follows in this chart. A1C less than 5.7 is normal. An A1C between 5.7 and 6.4 is prediabetes. An A1C 6.5 and over is diabetes. If you have an A1C of 6.5 or more, and then you diet and lose weight, so your A1C drops less than 6.5 without medications, then you still have diabetes, but it is in remission. So this is called diabetes remission. If you get an A1C over 6.5, but then after some measures with treatments and medications, your A1C is less than 6.5, you still have diabetes, but it is treated. Number 2, hemoglobin A1C is a gold standard to judge how well blood sugars are controlled. The A1C can be very useful to the clinician to guide treatment. The A1C is used in research studies to look at different diabetes variables and what affects them, and also diabetes outcomes, such as complications. However, I'm still going to relay some of the concepts that are actually drawbacks to the hemoglobin A1C. Because the A1C is just a snapshot of a 3-month average of blood sugars, it actually does not provide some essential daily information. For examples, it does not show day-to-day information, hypoglycemia, time in range of normal blood sugars from 70 to 100, time in range of normal blood sugars from 70 to 180, and hyperglycemia that is not longer than a few hours. So let's look at 3 examples that actually demonstrate the nature of these drawbacks. Number 1, a single A1C test can have up to a 0.5% margin of error, which means that the true value may be 0.5% higher or lower than the measured A1C. For example, a 7.0 may actually be a 6.5 or a 7.5. Number 2, interestingly, there are significant racial and ethnic differences that seem to exist in A1C readings for a given average blood glucose value. For example, Caucasians have been reported to have an absolute A1C reading approximately 0.1% to 0.4% lower than the same average glucose levels when compared to other ethnicities. The reasons for these differences remains unclear. Number 3, there are certain medical conditions that will change the A1C level due to a change in the lifespan of the red blood cell. Other mechanisms may occur as well. Here is a list of the possible conditions to affect A1C. For people with those medical conditions, instead of A1C, other labs can be used like the fructosamine, the glycated albumin, 1,5-AG, or continuous glucose monitoring. Let's go through a case study. A 47-year-old woman with type 2 diabetes begins to have uterine fibroids, which cause heavy bleeding, and her hemoglobin decreases by 3 percentage points. She develops iron deficiency anemia. How will this affect her hemoglobin A1C? And what is another way to measure her glucose control? Well, the correct answer is kind of a trick question because it's complex. It's actually going to be potentially influenced by 3 different factors. Let's say if she's still having the blood loss currently at the time the hemoglobin A1C is drawn, then the A1C will decrease. If she has iron deficiency anemia, then the hemoglobin A1C will increase. And if she gets a blood transfusion, then the hemoglobin A1C could decrease or increase. The best option for a lab would be the fructosamine level, because this measures the last 3 weeks of the average blood glucose, and she's having a lot of new red blood cell formation. Any of the other labs would serve as well, and the continuous glucose monitor is a great option. That concludes this webinar for hemoglobin A1C. I hope that this can help you to understand how the A1C relates to your average blood glucose and understand that it is the gold standard for evaluating your blood sugar control and success with management. Also keep in mind that the A1C is just a rough value and that there are other factors that the A1C cannot measure in your day-to-day individual readings. Because the A1C is the most talked about measurement of your diabetes control, I encourage you to rewatch this video one more time to make sure that you fully get all the information. Also, the webinar about blood sugar goals connects with this webinar, and it teaches other ways to monitor diabetes control by monitoring blood sugars and time in range. Thank you for watching, and I'll see you in the next webinars.